Let's do some more success stories. Now, this one is going to become a little more complex. So, we're going to have several slides. We're going to have several points where I'm going to stop and really give you some depth to what is going on and what we're discussing. This particular woman is a 73-year-old female who I saw in August of 2 years ago. And when I saw her, she, like a lot of people, like the majority of people that I'm seeing, had been to many doctors. She'd been to many dietitians. She'd had many tests and many treatments, but she really wasn't getting any better. This particular woman came in with her sister who had flown across the country. Her sister was the one who read my book and saw my information and thought, hey, you know what? This really applies to my sister. I want to take her to see this doctor and see if we can get her help that's a little bit off of the beaten path here, off of the standard treatment that she had been offered for so many years. So her initial symptoms when she came in were that her GI system felt like it was on fire. She felt like she had burning all the way through, from the mouth all the way down to the bottom. She was having lots of gas and flatulence that was foul. She was having lots of burping, and it had that burning quality to it, which is typically something that we associate with hydrogen sulfide dominant type of species. She had bloating in the mid-abdomen, and it was so extreme after about noon that she was so distended. She was so full. She just really couldn't eat. So she'd been losing a lot of weight, and she was also battling cancer at the same time. So she was in relative remission. She'd already gone through all her cancer therapies, except for some hormone blocking from breast cancer. So she really was not doing great, post chemotherapy, post radiation, surgery, and then with these gastrointestinal symptoms to compound it, so she had a hard time even leaving her home. She was having bowel movements a day, which is great. So she's actually moving her bowels, but she didn't feel like they were complete. And she noticed undigested food in her stool, which tells us a lot. It tells us that, first of all, the chewing process isn't going very well, because that's the only part that we have mechanical, actually grinding digestion. The rest is chemical digestion. But it also means that the chemicals are not able to do their job. The pancreatic enzymes, the brush border enzymes are not doing their job to completely break down the food. So these are important questions that an integrative physician would want to know all about the digestive process before you take the next steps to try to piece together, well, what's going on here. She was also having constant heartburn that was painful. So at the point when I saw her 2 years ago now, she was actually on a diet that was dairy-free, gluten-free, egg-free, and FODMAP. So that's interesting to me, is that she was basically off the gamut of inflammatory foods, dairy, gluten, eggs, and sugar, and she was eating a low FODMAP diet, but yet she was still having all of these symptoms: pain, flatulence, eructation, burping, a loss of appetite. So even though her diet was really clean, she was having all of these symptoms. So what that means to me is that we're dealing with a microbiome issue. Now, are we dealing with a yeast issue because she's fermenting? Are we dealing with a bacterial overgrowth issue because she's fermenting? Are we dealing with both? Is the problem that she's been on so many antibiotics that we've lost sight of the fact that this is no longer SIBO? This is most likely more of a SIFO, a small intestinal fungal overgrowth, or intestinal, and a complete small and large intestinal fungal overgrowth. Well, let's look at some of the tests she brought in. So prior to seeing me, these were her stool tests, GI-FX tests. She'd had 4 of them, and they were positive for Saccharomyces, Remember, Saccharomyces is something that you might be given as a probiotic supplement, but it can also take over and start to grow quite nicely in the digestive system. So this probably is not something she should be taking. She was positive for Rhodotorula, which is another yeast species. She was positive for 2 types of Candida and Cryptococcus. So 4 GI effects, dual tests, positive for a variety of these different yeasts, coming up in all 4 of them all the time. So obviously there's a fungal problem here. Now we know that this is a stool test, so it's really just testing the very last foot or so of the system. If this test is positive, does it mean that there's also this overgrowth of fungal species or yeast species in the small intestine? No, we can't say that from this test. We can only speak to the place where the stool is coming from, which is the colon, and typically the last end of the colon. So again, prior to seeing me, she had had 4 SIBO tests as well. They were always hydrogen positive, and she'd been put on 4 antibiotic treatments for these SIBO tests: Xifaxan, erythromycin, metronidazole, various combinations of these. She would take the antibiotics and she would retest, and the results would be the same. So her symptoms hadn't changed after the first antibiotic treatment. Her testing hadn't changed after the first antibiotic treatment, and yet the treatment plan was always the same for the subsequent 3 SIBO tests that she had. It was always take more antibiotics. Well, you can see right up here, there's also this other problem going on, and likely that problem is there because of the antibiotic use. Now, the drug manufacturers of Xifaxan will tell you that it doesn't touch the probiotics. It just kills the bad guys. I wonder about that. And my main question is, if we have 700 different species, and out of those we're aware of 2 main probiotic species, so there's still a remaining 698 species. When the Xifaxan manufacturers say that's not touching the probiotic species, they're talking about those 2, not the other 768. So is it shifting the microbiome when you take these antibiotics? From well-intended practitioners who are just trying to get, is that really messing with the microbiome? From what I've from these clients that are coming to me that look like this and have done so many antibiotic treatments and so many SIBO tests, I would say yes. This is what I'm seeing, is that a predominant number of those have an overgrowth of fungal species, usually after their wits end with this revolving door cycle of test Xifaxan. So let's go on to what we did. I put her on a soft food diet. I had her keep the dairy, the gluten, the sugar, and the eggs out of her diet, just because those are inflammatory foods. And, once they're out of the diet and a person is used to that, just keep them out. We can add them back in later to see if they're tolerated once the symptoms have gone away. But if you try and add those foods back in when a person is still having all of these gassy symptoms, then you're not going to have a clear picture to tell you, okay, this food actually is a problem. I started her doing a high-dose sulfur treatment at a very low dose of the GI Janelle 1 powder. We started with 625 milligrams a day, which is essentially 1/8 of a teaspoon. And then I had her do that. Just keep on doing that. No real big deals. We're basically just keeping things the way they have been for her and adding in a small amount of sulfur that we're going to titrate up. I saw her 4 weeks later, and she told me that all of her symptoms had improved. She had less gas, less pain, less bloating, less heartburn, and less of a burning sensation. And this is what I expect to see on this treatment. About 80% of the people that I do this with are going to come back and give me this report in 4 weeks. So our next step is to increase her GI Janelle 1 powder up to 1,250 milligrams, or 1/4 of a teaspoon. So we've gone from 1/8 to 1/4. And I saw her again 4 weeks later. I really like to have this repetition of appointments, especially early on. So this woman was with her sister-in-law who had flown across the country to help her go through this together with me. And told me that she did get, over the course of this 4 weeks, the second iteration of our 4 weeks, she did get some return of her symptoms. The abdominal pain and heartburn were starting to get worse, but the other thing that had changed was her oncologist had put her on letrozole, which is an estrogen blocker for her cancer treatment. And it wasn't anything other than that was causing those symptoms. So we had her work with her oncologist to find a different treatment that would help her block the estrogens like she needed to do to prevent the breast cancer from returning, but would not bring back some of her abdominal symptoms. They found something that worked, and those symptoms then resolved, so she went back to her relief of abdominal pain, of heartburn, and constipation, and gassiness. She was feeling better. I also ran a blood panel for her just to see, do you really need to be avoiding all of these foods? Can we try and start to open up your diet? Because now I'm feeling confident that with this GI Janelle 1 powder treatment, this high dose sulfur treatment, things are going to progressively improve along the way for her. So on that panel, food intolerance panel, she was positive for dairy and wheat, not for eggs, not for sugar. So I asked not for any of these low FODMAP type sulfur based foods. So I actually asked her at this point to start to in her non-wheat grains. So she was positive for wheat but not for gluten, so that meant that she could eat foods that have gluten in them but not to the degree that wheat does. So things like couscous, things like rye and barley and triticale and spelt, those grains that haven't been modified the way wheat has and yet still contain gluten. Add back in cooked onions, cooked crucifer vegetables, so broccoli, cauliflower, Brussels sprouts, and cooked garlic, small amounts of them, to start to get her body acclimated again to more of a nutritious whole food diet where she could extract good nutrients for herself. And then I also had her slowly titrate her dose of GI Janelle 1 powder up to 1,500 milligrams a day. So slowly titrate that level up to basically what would amount to half the total treatment dose. Usually I try and get someone up to 30,000 milligrams a day, or 30 grams. So there she went. There's her high-dose sulfur treatment up to 1,500 milligrams a day or 15 grams a day. Again, that's half the standard therapeutic dose. However, she stated that at that 1,500 milligram, she's asymptomatic. She has no symptoms at that dosing, and she has regular mints at that dosing, and she's been able to add her FODMAP foods back into her diet. So she's got those cruciferous vegetables, those allium family vegetables, the garlic and the onions back in her food. She's keeping herself wheat-free, dairy-free, and sugar-free. That's healthy. And as long as she does that and keeps on the 15 grams a day of the GI Janelle 1 powder, she is asymptomatic and her bowels are regular. So just a little caveat that I skipped over back in the slide, and that's that she started doing some work with another practitioner with mold, and they gave her a bunch of binders, and binders are things that can easily ferment to feel gassy. So she did have a window of return of her gassiness until she modified those binders to something that was a little less gas producing. I think she changed it from like a charcoal based to more of a zeolite based, and she did better on those as well. So it's always important to, when you've got a lot of irons in the fire and you've got a lot of different people that are working with you, make sure that they're communicating, make sure that they take interest in communicating with your other providers and understanding what are the other things that you're doing that are important for your health health that may be bringing back some symptoms, and how can we work to modify that to keep a patient so that they are asymptomatic and able to start incorporating more whole foods, more nutritious foods easily back into their diet.